Hey y'all, Dr. Kramer here. One of the most common questions that is probably asked of any doctor in their history or in their intake or in their first initial conversation with a patient is, how fast will my symptoms go away? It's very fascinating to me because most of the time patients come to us or have been trained to come to a healthcare provider or a service provider because of an ailment, right? They have something going on that is causing them a problem that has become so significant that it is now impacting their ability to live free of disease or illness, right? And so now you're starting to see this start to really implicate your daily routine. Maybe you're starting to get so dizzy you can't drive. Maybe you're starting to have heart racing and it's making you to be very, very concerned about what's going on. Maybe you can't lay down flat in the bed without getting the spins. Maybe you have some buzzing in the ear. Maybe you have some pain. Maybe you have insert symptom, right? Some anxiety, some fear, some whatever it may be. It causes you to start to seek out something, right, for help. And unfortunately, or fortunately, I think it's probably a dual-edged sword here. Most doctors confidently tell you that this pill, this service, this treatment will immediately cause you to be transformed. However, from my conversations with patients over the last 7-8 years, that is very, 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 very far from the case. And so, let's take mental health for an example. One of the most prescribed drugs in America is going to be an antidepressant, quickly followed by an anti-anxiety drug, right? So we're going to be looking at Xanax, we're going to be looking at Klonopin, we're going to be looking at an SSRI, we could be looking at Wellbutrin, we could be looking at any one of these things, right? And they change their names all the time. And oftentimes what ends up happening is you go into the doctor, you tell them, I'm feeling a little unsteady, I'm feeling a little of this, a little bit of that. And they say, well, it sounds like you have some heightened anxiety, let me give you a pill, right? And then it's, well, doc, how long will this pill take to work? Well, we're going to do a trial. We're going to try this out for 30, 60, 90 days, right? We'll go 30 days. And if the edge doesn't get taken off, right, then the change in medication is something different. Maybe we need to add a combination pill, right, whatever it is. And pretty soon you find yourself really messing with your physiology and your chemistry by an outside-in substance that is manipulating your perception of reality and never really actually doing anything, right? More than anything, it's just turning you into a zombie. Now, it's fascinating to me because when a patient comes into a chiropractic office or to a upper cervical office, even more specifically, they have this idea that they are going to receive one adjustment and they are going to be cured, right? This is the most insane, asinine principle I think I've ever heard, or the most unrealistic expectation I have ever been given inside of an office. It's actually humorous at this point because it's like, dude, do you think you gained 100 pounds overnight? No, you had to eat gallons and gallons and gallons of ice cream and not exercise and lay on a couch and binge watch Netflix and have no activity and no sleep, and all these things have to take place to create who you are in your current state of presentation. However, our biggest fear, our biggest concern is projecting the future, right? It's like, how do I get out of this really, really fast, right? And I'm like, man, you've been having this for 20 years. You've been having this for 10 years. You've been having this for 15 years. This is not going to go away quickly, right? This is going to be something that your structure and your neurophysiology have compensated for to transform into the current state of health that you have. So we have to undo that to recreate optimal, to give you the environment in which you can thrive in this life. So should there be a steady progress of adaptive changes that allow your body to express health? Yes. What does that mean? Over time, should your symptoms go this way and should your health go this way? Yes, that should happen. However, we are not going to chase the symptom, right? For so many of us, we are indoctrinated into this pill form that where if that pill doesn't work, I'm going to go to a different doctor, get a different pill. And if that pill doesn't work, I'm going to try another one. However, my question to you is, how long do you have to take that pill, right? If you're taking an anti-anxiety drug and you're on it for 10 years, obviously something else is going on, right? The anxiety should quell itself within a week, within 2 weeks, right? If you have the death of a loved one, depression is going to last you for 6 months. That's a known and studied physiological fact, right? It's a psychological, piece of the human experience. It doesn't mean we need to go take a bar of Xanax every single day just to try to compensate and cope with our loss, right? We have to face these things. We have to go through them. We have to process them. Much like the healing journey will be inside of an upper cervical office. And so to really qualify expectations of the patient on their symptomatic improvement, we aim inside this office to, one, eliminate variables. What that means is that we don't want to do too much at one point in time, because then we don't know what is actually working, right? We want to keep as much the same as possible outside of the upper cervical adjustment to make sure that we are steadily improving the quality of your neurological health. That is within our control, right? Now, if you choose to go on an anti-inflammatory diet or a keto diet, or you look into carnivore, I'm going to support that, because what you're doing is giving your body medicine in the form of food that will eliminate the inflammatory substances of the sad Western diet. It will eliminate the poisonous seed oils, the poisonous carbohydrates, the poisonous vegetables, and it will start to create an optimal environment for neurophysiology to thrive. So those things are good, right? That is a constant. That is something that you can pursue and do. However, we don't want to start adding in various things like exercises or stretches or changing our pillow or going into this idea of like, hey, we need to do a Denny roll or all these things, right? Because then the question is, which one is actually working? Most of the time, they each have an amplification on one another. However, not all of them are going to create long-term substantial changes. Those long-term symptomatic improvements are going to come from giving the right adjustment at the right time, at the right place, and then letting your body do the healing from the inside out. And see, it's really fascinating to us, because when you study physiology and you go into the world of health, period, you look at the textbooks that talk about the pathogenesis of the body, and they talk about the life cycles of cells, and they talk about how the body can heal itself from the inside out. Like we have new blood every 90 days, right? Or something along those lines, or the stomach is shedding X number of cells and regenerating the cells, right? Your bone goes through the outer layer that gets shed. We have new layers, right? There's this amazing metaphysical process that takes place inside the body that just needs to be coordinated into a optimal performance, right? The symphony has to be conducted correctly. And that is done by the neurophysiology. And if that neurophysiology is not operating at its very best, your ability to symptomatically improve is going to be significantly reduced. And it will continue to be status quo that you've been subjected to from our fellow Western paradigm of prescribing pills, potions, and lotions and surgeries. Right now, not saying a pill is a bad thing. Definite instances where we need them. Not saying surgeries are bad, because there's definite instances where we need a surgery. However, for the majority of the symptomatic presentations that we are trying to thrive in from a human experience, we do not need to be dependent upon these drugs. Our body is incredibly resilient. God did not design us to be sick. What we do know is that if we give the right adjustment, if we give it at the right time, if we give it at the right place, and then we monitor that over a course of care, symptomatically, you should start to see a reduction in your presentation of issues that over time will create stability, that will reduce your frequency and the necessity of care, and deliver for you a quality of life that you have been looking for a very, very long time. So for those of you who are in that chronic cycle of disease, for those of you that ask that question, how fast are my symptoms going to improve? The most honest and humble answer is, I don't know. I have an idea, right? We have a window, right? But much like the doctor coming at you with a medicine, they may tell you it's going to take 90 days, right? In my office, I typically tell you within 6 weeks, you should see something very much improved if you follow the recommended path of care, right? If you go to the trainer and you do one sit-up and one bench press and you ask him why I don't have a six-pack and how come I can't bench 500 pounds, but you don't show up for the work for the next year, we have problems, right? You have to show up. You have to put in the effort. You have to work on yourself. You have to work on healing, right? Those are all things that are necessary to allow your body to thrive in this life. So symptoms, while they may be the initiator of the reason for pursuing care, the elimination of them is only a start of the pathway to achieving optimal health.